I'm also very excited to be speaking to you guys specifically about our product, Florida Complete Care, Florida Community Care, and some of the enhancements that we're going to be doing. This is the first time that we're going to be speaking about this publicly, so very excited to bring this to you guys hot off the press. So really what we're going to discuss today is what is an institutional equivalent special needs plan, an IE SNP, which is a subset of an institutional special needs, the benefits that members, your residents, receive from enrolling in an ISNP, and the financial benefits of you, the nursing home or the assisted living facility, in partnering with us, and really giving you guys the tools to evaluate which are the best ISNPs in the market to partner with. So let's start off with the basics on what is an institutional special needs plan. And before we get started, can we have a show of hands? Do you guys know how many of your residents are right now enrolled in an ISNP or an IE SNP? Okay, so I see 3 hands up there. Now let me ask, because this is a little bit about what we're going to get to in the presentation. Do you guys know if your residents are primarily enrolled in original Medicare? Okay, so the majority. How about in a DSNP? No hands? Interesting. So we're really going to learn about the landscape of Medicare Advantage and what is the best option for your members, for you guys, and really what's happening in the trends in terms of member choice, what plans they're choosing to go into, and also what's happening at the federal level and what regulations are coming down the pipeline that are really going to impact you guys. So let's start off with the basics. So the Centers for Medicare and Medicaid, CMS, is the federal agency that regulates Medicare. And members have an option of staying with original Medicare or enrolling into a Medicare Advantage plan. So when a member stays with original Medicare, or what you guys probably know as fee-for-service, cover Part A and B and the prescription drugs, which is Part D, which is usually covered by a standalone PDP, right? So under that process, they're open to go to any doctor that accepts Medicare, but they do not receive any supplemental benefits. So if you see over to the right the difference between a Medicare Advantage plan, which also covers Part A, Part B, as well as the prescription drug under the Part D, and we also include something called the supplemental benefits, which is under Part C. So you'll see that a lot of these plans really go head to head on what are the supplemental benefits. And when we get into a special needs plan, which we'll discuss exactly what that is, it's just a subset of a Medicare Advantage plan. Those plans tend to have richer benefits for the members under Part C. But reality, a lot of these benefits are really kind of head to head in terms of what they offer. So you really have to look at the other features and determine what is the appropriate plan for you guys and for your members. So like we said, when we're talking about a special needs plan, there are 3 flavors of special needs plan. There's an institutional special needs plan, which is what we're talking about here today. There's a DSNP, which is for dual eligibles, and there's a CSNP for chronically sick individuals. And all of these are meant to cater to a very specific type of population. Therefore, they all require a different model of care, and they also require specific eligibility requirements on top of just needing to be eligible to receive Medicare benefits. So like we said, what makes a special needs plan very different is that every single special needs plan must have a model of care that's approved by NCQA and provides the basic framework under which they're going to meet the needs of their members. So this is a clinical document that pretty much outlines how we are going to care for a very sick population. So when we're talking about ISNPs, we need to know that they're created for long-term nursing home residents. So the eligibility requirements for somebody to get into an institutional special needs plan is that they reside in a nursing home for 90 days or they're expected to be there at least 90 days. When we're talking about an institutional equivalent, it's the requirement is that the member meets the nursing home level of care as certified by the state, yet is in the community. And when we say in the community, we mean either where CMS means they live at home or they live in an assisted living facility. But you can tell that really these people are just as sick as somebody who resides in a nursing home. The only difference is the setting which they're residing in. So the reasons why nursing homes should really be interested in ISNPs is two reasons. First is because ISNPs improve the quality of care that the residents receive, and also affords the nursing home leaders an opportunity to have the financial gains when partnering with the ISNP. Okay, so who can join an ISNP? First requirements is you need to be eligible for Medicare. You must have Medicare Part A and Part B. You must, and you meaning the member, must live in the planned service area. And like I said, the member must reside in the nursing home for 90 days or expected to be there for 90 days. And in the institutional equivalent, they need to meet that nursing home level of care. So the SNP that the member resides in must be in the plan's network as a participating ISNP provider. Meaning, go ahead.
Are assisted living facilities included in this?
No, because under assisted living facility, the member would be under the IE, so it's not a requirement, the institutional equivalent. It's not a requirement that that assisted living facility be contracted with the network. However, we'll get a little bit into it further when we talk about Florida Complete Care specifically. We always bring the assisted living facility and we make them partners through some sort of care coordination. So if we are talking about the ISNP and your members live in the nursing home, for you to be able to collaborate with the health plan, you must be a participating provider. You must be in the network of that health plan. So let's look a little bit about the breakdown of ISNPs. So currently we have 250 ISNPs nationwide, a little bit over 120,000 enrollees, with a 20% growth in the last 2 years of members choosing to enroll in ISNPs. A lot of that growth, and we're talking at the national level, is between the health plans that are owned by the nursing homes. So even though we are seeing this growth in the ISNPs in the last 2 years, keep in mind that ISNPs only make up 2% of those members who are enrolled in special needs plans. When we're talking, going back to the 3 different types, we see that the majority of members who are eligible and choose to enroll in special needs plans are in the DSNPs. To be in a DSNP, all a member needs is to be dual eligible, receive Medicare and Medicaid benefits, to be in the institutional equivalent, like we said, they must meet that nursing home level of care. And to be in a CSNP, they must have the chronic condition that that plan set out in their model of care that they are going to cover. So as you can see, I guarantee you that the majority of your residents, if you are in a nursing home or an ALF, the majority of your residents, if not all, are going to be Medicaid recipients. That means that they have a choice between going into a DSNP, an I or an IE, or if they have a specific chronic condition that a corresponding health plan covers, they have the option of going into a CSNP. So this is what's important, okay? Most members are going to choose to go into a DSNP. Why? Because DSNPs tend to have richer supplemental benefits. Remember we said that what distinguishes a Medicare Advantage plan from original Medicare are those additional benefits that they receive under Part C. When we get specific into special needs plans, and even more specific into DSNPs, this is where you're gonna see a lot of the supplemental benefits that are tailored towards low-income people, and it's gonna allow them certain monies to be going towards food, towards utilities, and that tends to be a driver for the member in choosing a DSNP. Now, the difference is that that leaves the ALF and the nursing homes out of the equation, right? So for this really to be beneficial for you guys as a nursing home, as the ALF, it makes more sense to be able to partner with an iSNP or an IDSNP. So when we look at the breakdown, 46% of Florida dual eligibles are enrolled in DSNPs. 29% is the national average. So we need to talk about what's going to happen in the DSNP world very soon. So starting in the year 2027 and fully implemented by the year 2030, CMS is going to require that any DSNP has a corresponding Medicaid plan, right? They're going towards full integration. So in 2027, the plans will not be able to enroll any new members that are not in a corresponding Medicaid plan, and by the year 2030, the existing membership needs to be fully aligned. So what does that mean in the state of Florida? That means in the state of Florida, we just went through our re-procurement process, there will only be 5 plans that will be able to hold a DSNP. And those 5 plans are going to be fully integrated, meaning that all of their Medicare members they're gonna be covering their Medicaid benefits as well. So as you can imagine, this is going to severely interrupt the market, and the point is, how do we get ahead of all of this? So let's talk about the benefits that your members receive from enrolling in an iSNP plan. Really, the main benefits to your members, like we said, it's not gonna be on the Part C, on the supplemental benefits that are very rich, because that's gonna be more towards somebody who's a DSNP. And typically, in the DSNP population, we're looking at a healthier individual. The reason why somebody would opt, from the member perspective, from the caregiver perspective, why they would opt to go into an IE or an I is because they need a higher level of care.